moment and has had a chance to compare testing methods in different countries. Daniel, good to see you. Now, you've taken the coronavirus test both here in Israel and now more recently in the US. Talk us through the different process, if you compare the actual methods, the service, and quite frankly, how painful it is.
Yeah, so Vanina, I've actually at this point been able to say that I've taken the test 3 times, twice in Israel, once in the United States. In each time I took the test, it was administered differently. Now, each time was also a drive-through sort of facility, but as far as the culture, the throat culture, the nasal culture, it was different each time. The first time, you have a swab, they stick it way, way, way up your nose, way down your throat, as they do it in almost every single test that someone takes. Of course, now with different technologies, there are different ways to get tested, and that definitely was the same also the second time. And in the U.S. here, it was only a nasal culture. There was hardly it took less than 20 seconds. But now when we talk about getting results back, and this is just as important, Benita, of course, as the test itself. In Israel, before I flew, I was able to take a coronavirus test at a drive-through facility. I got the results within 24 hours. I was quarantined in that time. I took a flight. No one checked my corona test results upon departure or upon arrival in the United States. When I arrived in the United States, I waited 5 days. I took another COVID-19 test at a drive-through facility. Now, here is maybe the main issue, is that my results will only come back within 5 to 7 days from the test itself. I have spoken to people firsthand that have said that they didn't get their coronavirus test results here in the United States in a state like Maryland within 2 weeks. That's a very, very long time, and it's a long time, especially if the individual is not staying in quarantine. And you wonder, what really does the test itself do, aside from telling you that when you took it, you didn't have the virus, but you may have contracted it since then. So as far as it's concerned, and because Israel maybe has, obviously has a different healthcare system, it might be more standardized. In the United States, they might have more options. I also know that people in California, for example, that have taken the test and gotten their results back within 45 minutes. But that can be expensive. It can cost upwards of $100, and it's not foolproof. It's not guaranteed. I know someone that got an expedited test here in the state of Maryland. They did not get their test results back necessarily within the exact time that they were expecting. And so as far as that's concerned, maybe without the amount of standardization, it becomes more difficult to actually have these things on one track and one standard.
Quite worrying to think that people would be waiting for so long for a result, but wouldn't be waiting in isolation. That really is an interesting development. Daniel, you've been covering the crisis here in Israel for many months now. Talk us through, if you compare again the two countries, how the public is reacting to having these tests, to queuing and waiting to get them, and just the perception generally about how people are sticking to the rules. What are you seeing if you compare the two countries?
Yeah, so I have a small sample size, of course, but what I can say, first of all, Benita, and I think it addresses the point you made there about enforcement, which obviously has an effect, an impact on the way the public is behaving and reacting, is that in Israel, the enforcement is very aggressive. It's comprehensive. In the United States, across the board, it's per state. So on the state level, even, you don't have the same level of enforcement. So even when it comes to something like testing, it's not necessarily that you're going to be in a quarantine enforced in the same way that you would be in Israel. In Israel, the quarantine is enforced. We also all know about that sensitive issue of tracking in Israel, the Internal Security Agency, the Shin Bet, that tracks at times people's cellular phones to ensure that they're actually abiding by the quarantine measures. So here in the United States, the quarantine isn't enforced in many states. There are some where it is. It's voluntary. But what I have seen is that in regards to wearing masks, as you said, waiting in lines and things of that nature, it does seem as though maybe in certain parts of America that there is more attention paid towards those social distances. But when you look at other places, you start to understand these issues start to become politicized. So in the southern states, you might be looking at a very different scene where people are not wearing masks, sometimes not even wearing masks in closed spaces like supermarkets. And so that is very different the way you see across the board in Israel, where even if people aren't abiding by the restrictions. The police are absolutely enforcing those restrictions in a way that they are not enforcing here, because that's not the protocol and that's not the rule that has been set by the local municipalities by and large. Of course, every state has its own sort of approach, and we see different states reacting differently to the public, and in turn, we see the public acting differently as well, Benita.
Interesting to hear those comparisons. Thank you so much. That's our Daniel Tzemach speaking to us live from Washington. Be well.